This episode of Cape Ann Today is brought to you by J&L Welding.
I am speaking with Gloucester's Director of Public Health, Max Schenk. Hi, Max. How are you doing?
Excellent, Heather. How are you today?
I'm good.
Good.
Fingers crossed, we seem to be moving out of the most recent episode of the COVID-19 virus. Can you start just by updating us on what's happening with the virus in the city?
Absolutely. So in terms of the city's regulations, as probably everybody knows by this point, the Board of Health rescinded their overall mask regulation for city public spaces as well as city buildings. So that ended, I think it was the February 11th meeting. Now, the numbers continue to go down, thankfully. So at the height of COVID, our daily case rate, new cases, was over 100 a day. So it was really through the roof. Now we're, under 20, generally speaking, and most of the time, even under 10 cases a day. So that's, boding well. Our most recent wastewater testing is showing case rates numbers going down as well, almost to, sort of late spring last year, where the numbers were then. So, it's down significantly. So we're very optimistic that way. It's what helped provide some of the information that the board needed in order to make their decision. And as you know as well, that the school on February 28th had decided that they were going to make masking optional. I should actually state that even though the board had rescinded their regulation and other requirements, the board stance is still that if you're in, along with the CDC, if you're in an area of public space where indoors where people are of unknown vaccination status, masking is still a good idea. We highly recommend it. But there's no enforcement capacity behind that, but we still recommend it. I still, for instance, even in our offices, and knowing the vaccination rates here are pretty high, that I still wear in common spaces a mask. So, but that's my choice, and we respect the choices that people are making right now. We also, though, our big push is vaccinations. I mean, that's what we've been saying straight along. Once vaccines became available and more broadly available, that the best way to protect yourself against the worst aspects of the virus, whatever variant it is still vaccination. So our first and second dose vaccination rates in the city are pretty high. They're getting better, progressively better. So we're focusing now on booster vaccinations and getting those numbers up because those are the critical points.
And is it still relatively easy for people to find boosters and find vaccinations?
Yes, so pharmacies still continue to provide them. We ourselves are going to be focusing on, providing vaccinations for youth in schools. So those that are eligible and can get first, second, and booster doses. We have a clinic coming up, as a matter of fact, on February 26th at the Our Lady of Good Voyage Church. Forgive me, that's going to be from 1 to 5 p.m. And that's in partnership with the Greater Cape Ann Community Collaborative. It's walk-ins, there's no registration needed. And they'll have the Pfizer vaccine as well. And there'll be future vaccine events held there, but we'll also be holding, to count to date, approximately 18 vaccination clinics within the schools themselves. So 9 times 2.
So, and is the clinic at Our Lady of Good Voyage, is that for children also?
Yes, correct.
Okay, great.
Yep.
Any limitation on ages? Do you only want children, or are you? Okay.
No,
Anyone can
come
walk.
one, come all.
Okay.
Our goal is to get as much vaccine out into the public as we possibly can. We also have to be very judicious about, our own capacity to provide vaccine. So that's why, the vaccine clinics at the schools are going to be in partnership with Beauport Ambulance. They're taking the lead on helping to provide that in the schools themselves. And they've been very successful with that so far.
Well, going forward, so we're all hoping that this event of 2 years is coming to a close, but it may not be, because we were all thinking this about a year ago. What are you thinking as the Director of Public Health about the future? Are you getting guidance about what happens if there's another wave?
Well, I think the response that you'll see is similar to the response that you've seen previously when there have been spikes, and probably, hindsight is always 2020. Everybody got very relaxed over the summertime, and because numbers were, almost negligible. And, it took a while to ramp up again to respond to any, to the newer threats. And by then, let's face it, everybody was kind of burned out from it, and I don't blame them. And we're all kind of burned out as well, but we have to do what we have to do. So along those lines, we'll keep an eye on the landscape and see what happens. But you hear the word endemic being used a lot, and much like the annual flu is endemic. And will that be the case with COVID? The larger minds than mine are saying that's the case, and it's the case now, as a matter of fact. Whether or not COVID itself will have become an annual vaccine, much like the flu vaccines are, is yet to be determined. It is most likely that'll be the case. And they'll have to adjust for whatever variants are out there or being projected. But that it has been the problem with this particular virus, is the fact that it mutates quickly.
Mhm.
And so unlike the annual flu vaccines, as a for instance, where they can do some studies and they've done their research and they know the areas where these viruses typically come from, so they can get a crystal ball view, as it were, as to which ones may be more prevalent. The COVID virus doesn't give you that opportunity. It can change on a dime when it wants to, and that variability just makes everything else more challenging.
Mm. Well, let's leave the virus altogether. There was an issue that came up last spring that was really concerning for a lot of people. And that was this state program of spraying for mosquito-borne diseases. And the state, I think at the very last minute, sort of said to communities, well, you can opt out, but it required a real hustle to figure that out. And I think you were part of that process, right?
That's correct. So we were alerted actually by community partners that this was coming down the pike. And so we did a quick scramble, and along with other communities, it wasn't just us. And there was quite a blowback as to the timeline that was created for this to happen. So what it basically states is that the Executive Office of Energy and Environmental Affairs, in partnership with the Department of Public Health and their mosquito control program, if they decide that there is an imminent threat or need, can unilaterally decide to opt in, perform spraying in whatever community or region that needs be. Now, for those who don't know, there are mosquito control districts in Massachusetts. You can opt into being part of a mosquito control district. So, or in our area, it's a Northeast Mosquito Control District. And a number of the communities in our area do participate to one level or another. Now, the problem is that the cost of belonging to a mosquito control district is based on your cherry sheets. It's all budgeted stuff. But when Gloucester looked into it, gosh, I want to say at least 5 years ago, it was $80,000+ a year for a mandated 3 years, regardless of what level of service you use. So if you wanted just testing to see where you stood in terms of mosquitoes as a vector in your community, then you're paying $80,000+ a year for that privilege. If you want the soup to nuts, services, then fine, you're getting your value out of that. But and generally speaking, the mosquitoes found in salt marsh mosquitoes are not necessarily a great vector species for arbovirus in our area, and that's the majority of the mosquitoes that we have. Do they, do others exist? Yes, they do, but the prevalence isn't the same. So when the state said, well, we're thinking about doing this, and you can opt out of the program if you'd like, the community as a whole and the board discussed this, said that yes, we'd like to opt out. So we were charged by the city council to form a plan, which was part of the opting out process. And the plan was specifically geared towards just doing, well, it's actually a multi-tiered plan, and based on the severity or prevalence of or threat of arbovirus in our area. We were very fortunate this last year that it didn't really take off at all. And along with COVID, that's the least we've needed.
Yeah.
We were able, just through education and outreach to the public on an intermittent basis, and some articles in the newspaper, our Facebook page, and our city website, updated people and reminded them, use proper precautions at dusk and dawn, and self-protection is the best protection, using a spray that can meet the challenge of the mosquitoes in our area, that sort of thing.
Mm.
So far so good. Now, in terms of what's going to happen this year, we're not quite sure. We did put in our required report at the end of the year. So everything looked fine. Everything seemed to be okay. But there was a meeting recently in regards to overall changes to the mosquito control program. A lot of them were pretty good, but one of the things that we wanted to keep in play was the opportunity to opt out. So, kind of keeping fingers crossed and looking at the landscape to see what comes up, and we'll respond that way. I want to say that both Senator Tarr and Representative Ann Margaret Ferrante were great partners in helping us get through that process.
That's good to know. So what you're saying is that you're anticipating the city council will, if they're given a choice, to opt out again this spring. We don't know if that's actually certain that we have to. Is that right?
I think it's an annual process. Yeah, it's an annual process. We'll have to do this every year, and well, at least that was my understanding from the last time.
Yeah.
So things can change, as we know, on a dime when it comes to the state. So we will hopefully get a better notification as to what's going to happen come May, thereabouts. Our application had to be in around that time last year. So I'm hoping before then they'll let us know, especially based on their previous experience with how many communities complained about the timeline on the process. Right. Hopefully we'll get more of a heads up and can respond accordingly. We also have, quite a few new council members this year. So we'll have to, put it before them again and see if it is something they still want to move forward with. It's something that I believe the board believes in opting out, but it is the council's decision in the end.
Right. But having already created your option plan to present to the state, that's helpful this year, right? Having already done that once.
Yeah, we can use that as our template moving forward.
Yeah. Right, exactly. Yeah, as opposed to having to do it on the fly.
Right.
Did last year, as they say. Yeah.
Exactly.
Well, anything else you would like people to know about the health of the city of Gloucester?
It's gosh, you always sound like a broken record when you have these conversations because the COVID keeps on popping up. But our big push is vaccinations. Please, if you're eligible, first, second, or booster, get vaccinated. It's your best protection. We've all said in the department that we'd love to get back to, fully focused on other public health concerns. But, we have to recognize this is the concern of the moment, and it's global, and it's not going away anytime soon. We're going to be grateful for the downturn right now and hope that it stays that way and plan accordingly in the future. But no, that's good. I just appreciate the opportunity to have a conversation with you.
Well, thanks very much. Really appreciate it.
Thanks, Heather.
Yeah.
Interested in a sponsorship? Email sponsor@1623studios.org to learn more.